federally qualified health centers, or FQHCs, can play in the Department of Housing and Urban Development's EnVision Center initiative to improve healthcare access and equity for public housing residents. So I am going to discuss a range of efforts that we have made to highlight how health centers and can improve the health of public housing residents by playing a partnering and supportive role in the EnVision Center initiative. And I'm going to discuss some of our collaborative work with HUD and health centers to create awareness of the EnVision Center and our role as a liaison between housing authorities, EnVision centers, and health centers. But to set the stage, I'm first going to provide a very brief background on health centers, public housing residents, and EnVision centers, then talk about some of the opportunities for collaboration between these organizations, including strategies and recommendations on how to build and sustain partnerships. And one way to do that is to work together to improve maternal health. So I'm going to highlight some of the baseline research we did on prenatal visits at health centers that are located at EnVision Center sites, just as one example of how to address the maternal health of public housing residents. And then I'm going to end with some challenges, a summary, and some next steps. So for those of you who aren't familiar with the National Center for Health and Public Housing, it's a national training and technical assistance provider. We work directly with health centers, housing authorities, and other stakeholders to increase the access, the quality of care, and improve health outcomes and health equity of public housing residents. And we focus on housing because of the many ways that housing and the environments and the neighborhoods where public housing typically resides impacts health and well-being. And I think most of us are familiar with the social determinants of health, how housing quality can affect the level of allergens in our lungs or lead in our blood, or how food environments affect the sodium and the saturated fats in our diets, and how crime and violence and safety affect stress and cortisol levels in our blood, which impact both our physical and our mental health. And for the roughly 2 million individuals that live in traditional public housing, they are particularly vulnerable. These are the households that grapple and contend with poverty and disability. Many of them are headed by single moms. Over half of them have less than a high school education. And you can really see how all of these social determinants impact the health of public housing residents. Adults that receive housing assistance have higher rates of chronic health conditions and are greater utilizers of healthcare than the general population. And while you take a moment to look at these statistics, you'll see that not only is the prevalence of disease much higher among those with HUD assistance compared to the general public, but there is also a difference between people living in public housing compared to other low-income renters with the same income group, which really demonstrates the degree and the magnitude that housing and neighborhoods and all of these social determinants of health are affecting the physical and mental health of these individuals. So around 30% of adults with HUD assistance cite health centers as their primary source of care. In 2019, the roughly 1,400 health centers provided care to almost 30 million patients. So they are a critical part of the healthcare safety net. There are around 433 health centers that are located either directly on housing development sites or near them. And they provided care to almost 5 million patients in those communities. And then there are 108 health centers that receive public housing primary care grants, or PHPC grants, to provide care specifically for public housing residents. So in 2017, HUD established the EnVision Center program. So the goal was to increase the opportunity for low-income families to achieve self-sufficiency through a 4-pillar model: economic empowerment, educational advancement, health and wellness, and then character and leadership. And the idea is that EnVision centers operate as a central hub of service delivery, and they can be managed by many different types of organizations, by local governments, public housing authorities, nonprofit organizations. The vision is really to expand opportunities for low-income individuals by coordinating the delivery of programs across multiple departments and agencies, and integrating those programs with local government and private resources at these centralized locations. So essentially creating a one-stop shop. But if you take a closer look at HUD's recommended goals that they've outlined for each of these pillars, you'll see that at its core, it's an initiative that aims to address the social determinants of health. So under economic empowerment, HUD recommends improving the employment rate, which is good. Under educational attainment, it's to increase the number of GEDs, which is better. Under character and leadership, it's to increase social supports like civil engagement and mentorship programs. And then many of the recommended goals under health and wellness are focused on clinical care outcomes. HUD even calls out FQHCs as a place to increase prenatal visits and annual checkups, along with other important screenings that are particularly important for public housing residents like lead, diabetes, and cancer screenings. So partnerships with health centers and EnVision centers just make sense. It gives these organizations the opportunity to align the agenda and goals and provide an integrated approach to delivering services, which hopefully will lead to improved health outcomes and health equity for public housing communities. So we at the National Center became involved in the initiative at the time of its launch, and we had 3 broad goals in mind: to raise awareness of the EnVision centers in the health center community, to facilitate and vice versa, and to facilitate partnerships between EnVision centers and health centers and housing authorities, and to provide guidance on health promotion activities that were most likely to impact the health and well-being of public housing residents. So in 2017, when the first 17 sites were announced, we participated in the kickoff and partners meetings for several sites. We've also been involved in meetings with leadership, regional directors, and EnVision center leads. And we started to get a sense of the local players and the local dynamics and the assets that played a role in these projects taking off. In 2019, there was a slight change in the second round. HUD had revised their guidance on health and wellness before they had these 4 required goals, and then they softened them to the list of the recommended goals that I mentioned earlier to give communities some more flexibility in the scope of their health activities. And then as the number of sites continued to grow, so as of April, I think there were 42 sites in 34 cities, and with a pre-COVID goal of getting that number up to 100, which may have been modified because of the pandemic. Anyway, through our engagement with these organizations, we identified some common challenges in developing these partnerships and developed some resources and reports in response. And I'm going to talk about those briefly. We created maps and directories and webinars and trainings and reports. So one of the first challenges was essentially the very first step, finding a health center partner. So we developed an interactive map that has the location of EnVision centers and health center sites, as well as housing authorities and public housing development, so that anyone can zoom into their neighborhood and see exactly where everything is located, identify whether or not they're serving the same populations, whether services could be provided, where they were, if they were in enough proximity to each other, or if it made sense to need to share space if needed. We also developed a basic directory with updated contact information for EnVision centers and health centers. Much of that contact information isn't available on a website, and we wanted to make it easier to reach out to each other with numbers and emails that worked. And I know this sounds very simple, but it's actually a very challenging first step. We also developed a report that outlines opportunities for collaboration and strategies to create and sustain partnerships. So this was part of our efforts to raise awareness of the EnVision Center initiative, as well as introduce health centers to individuals in the housing sector that might not be aware of them. In the report, we outlined examples of collaborations around 3 buckets: improving access to care, like enrolling individuals into health insurance and other public assistance programs; improving health outcomes, like conducting community health needs assessments; and then addressing health equity, such as improving access to broadband internet and telehealth services. We also talked about what mechanisms you might need to have in place to sustain a partnership, like membership on each other's boards, establishing MOUs or lease agreements. We also spent some time outlining some guidance on how to choose a health and wellness goal that fits the needs of the community and the capacity of the staff that's involved. And so it points out national and local health data sources, as well as reinforces the benefit of partnering with a health organization to help monitor and track and evaluate short and midterm impacts on health outcomes. We decided to talk about the importance of maternal care, healthcare, because in an earlier phase of the EnVision centers, there was a clear goal of increasing prenatal care visits at health centers. There actually isn't a lot of data on the maternal and infant health of public housing residents specifically, although we do know that there are maternal and infant mortality rates, there are higher maternal and infant mortality rates among low-income populations, as well as a severe disparity in those indicators for minority populations, particularly African American Native populations. So for those EnVision centers that were considering this route, we wanted to provide some baseline data to them to help them, inform them of the importance. So we analyzed some prenatal metrics that are collected in the uniform data system. That's the data that all health centers collect and report, including differences in access of services based on race and ethnicity. And we provided some of the high-level findings for all health centers that are located in all of the 42 EnVision center site locations, as well as state-by-state profiles that gave some more local level data. They list the names and the locations of the health centers, and then the aggregated data at the health centers for total prenatal patients by race and ethnicity. And we also wanted to include a quality measure, which is the stage of pregnancy during their first health center visit. So we know that providing prenatal care at the earliest stages of pregnancy and continuing that care to term results in better outcomes. So women in their third trimester visiting a health center for the very first time is a flag. So we suggest a good project would be to identify those challenges those women faced in accessing care earlier in their pregnancy, and then working with EnVisions to improve outreach to see if that partnership could shift those numbers in any way. So even though this is a coffee and donuts relationship, there are some challenges. According to our most recent poll, only 42% of health centers said they were actively partnering with a local housing authority. And the problem is that traditional public housing has been underfunded and diminishing for the past 10 years. Because the public housing landscape is changing, health centers really need to rethink their normal strategy for outreach to an already hard to reach population. So it'll be very important to extend beyond housing authorities to other initiatives like the EnVision Center initiative to care for public housing residents. I do briefly want to say that there are a couple of EnVision Center, a really successful health center and EnVision Center partnerships that have occurred in Spokane, Washington, and San Diego, California. Each of those health centers have worked on a range of health initiatives, so not just limited to maternal health. And the reason for their success is because there was already a history and a relationship between those partners. So there's trust and this institutionalized cooperation, as well as resources to support those activities, which is very important. The reason why I haven't mentioned money so far is because this is an unfunded initiative. So we are continuing to raise awareness on the value of partnering with EnVisions, creating platforms that will make it easier to connect, providing TTA where needed, and conducting some qualitative research to highlight and share best practices. And given the pandemic, we have focused some of our efforts on addressing the coordination and need to improve testing and education on COVID for these communities, as well as flu vaccinations and planning for distribution of COVID vaccination once it's available. So that's all I have for my time today. I'd like to ask you to visit our website to get more information, access resources, sign up for our newsletter, follow us on social media, or you can reach out to us if you have any questions. Thank you very much.